You can start.
Okay, so today we have the differential diagnosis of hemorrhagic stroke with the cerebral infarction, principles of differential therapy. Okay, the introduction. The hemorrhagic stroke and the cerebral infarction are two types of stroke caused by different underlying mechanisms. The hemorrhagic stroke occurs when a blood vessel in the brain ruptures, while the cerebral infarction is caused by blocked blood vessel in the brain. It's important to distinguish between these two types of stroke as they require different treatment approaches. Okay, the clinical features. The clinical features of the hemorrhagic stroke and cerebral infarction can overlap, making it difficult to distinguish between these two. So, the hemorrhagic stroke often presents with the sudden onset of a severe headache and vomiting, and the decreased level of the conscience. Whereas the cerebral weakness or numbness on one side of the body, the difficult speaking or understanding speak, and visual disturbance. Okay, as we see here in the photo, we have the two types of the central illustration. We have the primary and intercerebral hemorrhage and the secondary intercerebral hemorrhage. So next. Okay, the key diagnostic tests, we have the imaging tests such as computed tomography, CT scan, and the magnetic resonance imaging like MRI can help to differentiate between the hemorrhagic stroke and the cerebral infarction. CT scan is often the first test performed to determine if there is bleeding in the brain, while an MRI can provide more detailed information about the location and the extent of the stroke. The principles of the differential therapy. The treatment of hemorrhagic stroke and the cerebral infarction differs. In hemorrhagic stroke, the goal of treatment is stop bleeding and prevent further damage to the brain. This may involve the surgery to remove the blood or repair the ruptured blood vessel. In cerebral infarction, the goal of treatment is to restore the blood flow to affected area of the brain. This may involve the medication such as aspirin, thrombolytics, or mechanical thrombectomy to remove the blood clots. Okay, the conclusion. The conclusion is the hemorrhagic stroke and the cerebral infarction are two different types of stroke with the similar clinical features. So the imaging tests such as CT scan and MRI are essential for making an accurate diagnosis. Treatment depends on the underlying mechanism and requires a different approach for each condition.
Okay, thank you.
So thank you.
The next, 13 Joel.